things. Otherwise, they don't require any outsourced consultancy. Charitable hospitals, government is now outsourcing the things. What Dr. Meena has told in the morning, they have started outsourcing the things. Why? Because government નું કોઈ સાંભળતું નથી. Government ના ઓફિસરો આવે એટલે સાંભળીએ પણ the change which he brought in, એટલા જ માટે મેં સવારે એક સવાલ પૂછ્યો કેટલા PSC થયા MMBS, because સરે જે કીધું એક સિનેરિયો અમારા નજરમાં હતો ગવર્મેન્ટનો અને આપણે ગવર્મેન્ટ હોસ્પિટલ્સની સેટઅપ જોયા છે, પણ એમાંથી જો આવા સેટઅપ 10 કે 12 પણ થયા હોય તો that is a matter of appreciation, literally appreciation. In government setup to bring, if it is possible in government setup, it is equally possible in any of the trust hospital setups or any of the hospitals, a small nursing home.
So live example is IKD, where the staff was totally change resistant.
That is another case example.
કઈ કરવું નહોતું, વાત જ કરવાની તૈયાર ન હોય સામે.
Instead of
kidney turnover annually.
Yeah, exactly. IKD, Institute of Kidney Disease and Research Center, Ahmedabad Civil, is actually performing 400 transplant operations in a year, 2,000 patients OPD, 150 crores turnover, government autonomous body. There we have implemented HIMS. And you know, overall government, there is a contract of TCS, almost all 26 civil hospitals and 6 medical colleges. Only IKD is the setup where TCS is not there and some other company is there. That's our sister company. There actually what fails, it's a mindset of a person fails. I asked Dr. Meena also, how you change the mindset of a person? Nurse avine em ke bhai amara entry nathi karvi. If you don't feed the data into the system will never work for you. You have to feed it. And their political will there, the management will was there, and they said કે જેને કામ ન કરવું રાતના 4 ગણો બેહાડજો ત્રિવેદી સાહેબ એવું કહે. And ultimately they made the things. Right now you will be surprised, it took 9 months. It took 9 months to keep the whole hospital online. Right now a whole hospital is digitalized. You can get any kind of reports, everything on a upgraded manner. They have fax installed, they have everything in government setup, in an autonomous body. If you see almost every day 10 lakhs of rupees of pharmacy turnover. So everything is integrated and that is possible in IKD. And that has been actually nominated for e-governance award also in Hyderabad, I think last year also. Health Minister has appreciated that. So on one side that the resistance to change is there, but still if we can think, we can make that change. But my concern is, sir, it's different. I used to tell sir, rather than focusing on big hospitals, let us focus on the small hospitals. Honestly speaking, if a single speciality or a multi-speciality 3-4 doctors ભેગા થઈને 10-15-25 બેડની હોસ્પિટલ ચલાવતા હોય, you can say that you have to hire a hospital administrator which is costing you 50,000 or 20,000 or 25,000. અરે હોસ્પિટલ એડમિનિસ્ટ્રેટર ની હું જરૂર, હું છું ને ભાઈ. And there
એને આવડતું હતું તો જરૂર ક્યાં હતી?
આવડે. That on the contrary, it is not that. It is, see again the fraction which what I mentioned it, a figure cannot be counted, but unfortunately no one has shown it on the balance sheet approach. In Saurashtra, usually in Saurashtra, they are traditional businessmen. There is a lack of professional attitude. That gentleman fellow came from Hyderabad, he was asking me what he was expecting, and when I was talking to him in the lunch time, I said him, over here you can see a person who may be having a very high business, but at the same time the corporate outlook is missing, corporate professional management is comparatively missing. Though despite of that professional abilities, clinical acumen, skill sets, all the resources, the growth has to be 10-fold high. Unfortunately it is not 10-fold high. It is definitely high, it is definitely 2 times, 3 times higher. But now, considering the recent scenario of political change in the government of Gujarat, under the visionary, I will always say it's a visionary leadership of Chief Minister Narendra Modi. He runs the state under CEO. What he says, otherwise how many politicians think of doing this, by PhD and NMBH accredited karao? What does make a difference? What Dr. Meena said, there is a special post that has been created for State Quality Assurance Officer. So that's an initiative. So when it comes from the top, what you said rightly, it should come from the top. Now it has started coming from the top. And now our concern, ખાલી રાજકોટ નહીં, સૌરાષ્ટ્રના ગમે તે ગામ, ગોંડલ, ધોરાજી, ઉપલેટા, જુનાગઢ, પોરબંદર, you see કેટલી હોસ્પિટલો? How many hospitals are there? How many people, કેટલા patients, કેટલા bed? જુનાગઢ એવું કહેવાય છે કે it's an heaven for doctors. It's an heaven for doctors. Unfortunately, that is not coming on a single platform. If we really wanted an infection ratio જોવા જાય તો સાહેબ આંકડા આમ આંખ ચાર થઈ જશે. It is not a glowing picture which is over there. Unfortunately, we have killed so many patients. It is our social responsibility. If we are, as a consultant, our charges may be different, and then we say okay, we can do it in a different way. We can create a platform like association. We bring them together. We share the resources. Say for example, if an administrator is not being afforded by one hospital, it can be afforded by 2 or 3 hospitals in common. So there is not need for a full-time hospital administrator at that time. A 10-bedded hospital doesn't need sanitary inspector full-time. So one sanitary inspector can look after how this quality can be implied or applied with a minimum or optimum utilization of their resources. And we can say we can overall uplift the overall healthcare scenario. That's actually our dream or our vision. I don't know, it is a small step of this Hospitech India and IHF initiation. I said it's our commitment to the society. If we can create some value to it, we have created a platform or we have created a bouquet of services. So even doctors should not feel I am paying or I am doing this. We have created it at a very optimal cost. We try to keep them. We wanted to give them hospital management systems. We wanted to give them with the training modules. We wanted to give them with number of good services on a single platform. In that platform, we can cater them. And we will be keeping that revenue and finance model on a different scale. I had an opportunity to discuss it with a number of good guys. I think I discussed with Vaibhav and everyone. How we can contribute, how we can do the things. If this is an idea, I just know, I don't know, but this is an idea I have coined it up. It's an initiation, it's an attitude. I always believe in an attitude. I am always a positive-minded person. I never see the negatives in anything. I always see all the positives in the things. And if we can create, life is a very small thing. આ બહુ નાની લાઈફમાં થોડીક કઈક વસ્તુ આપણે આજ કરીને જશું તો આવતીકાલે કદાચ લોકો ખરેખર આપણને યાદ કરશે. યાદ કરવા કરતા it is our contribution to the society. And at the same time, I never wish, હું હંમેશા એવું માનું છું, I am a man of experiment. That fellow, again, the Mr. Anand, he used to ask me, you are a different person. Why? Like I am an open person. It's an open book exam. So there is nothing to hide. Let us create a momentum. This is an initiation. I have created 2-3 portals. One is yourdoctor.in, www.yourdoctor.in. Another one is hospitalworld.in. Hospitalworld.in is going to be IHA platform. And there are some of very good web presence. I have an IT team who is definitely helping me out over there. And fortunately, I got very good response. And we have created some of the aims and objectives of the association to set standards for improved holistic healthcare delivery. This is initiated with healthcare management, but I have tried to improve the holistic healthcare delivery because I wanted to include the Ayurveda, homeopathy, Unani, Siddha, whatever the holistic concept of health is there, and that total inclusive therapy has to be there. We have observed it's not only a quantitative measure, it should be a qualitative measure. And we have seen number of being a homeopath by profession, I have a high regards for my system. At the same time, I have a very high regards for Ayurveda system of medicine. It has its own offerings. So why can't we keep everything on one platform, ultimately into the benefit of humankind? So that is an holistic healthcare delivery. To carry out training sessions, seminars, CMEs, conference throughout various modes. It's an initiation. Let it be a continuous phenomena. How we can continually training for doctors like entertainment, we can create it. To promote health safety practices and improvement in quality of healthcare, thereby preparing healthcare organizations ready for accreditation. Accreditation, for me, it's not a big deal to get a certificate. I consider it like a degree certificate. Many of PGDHM and MHM students know it, what we are really learning, what we really study in the classrooms. How much it helps and it applies into the practice, we know ourselves very well.
Getting a piece of paper is very easy.
It's not going to work. Yeah, definitely it marks that you have at least studied this subject. But accreditation, if you follow the accreditation, see there are policies and standards, it really improves your efficiency of working, it will improve your proficiency, it will increase the output and everything. So, following the standards rather than what I say, supervisor, anytime I never promote कि भाई NABH accredited कराओ. I say कि you set the system, you improve, you follow the operations and SOPs prepared by sir. I'll tell you honestly, sir is a celebrity in hospital management field, while I am zero, literally zero. I'm not telling wrong or right. I am never qualified in hospital management system. While sir biodata आपने पढ़ा होगा 3-4 पेज का है. He is working in field since how many years, sir? 20 years. And I just execute. I am learning every day. I am learning with a different set of. I used to learn so many things. It's a simple things and that we learn. Basically, I am a man of HR. I am a man of psychology. I am a man of management. Where sir's role completes, my role starts. That's why I said our tuning matches. So that's the thing. How if we can, I just simply follow the guidelines. ऐसा करना है, so you just follow the things. If you follow, you are going to get the results. And I am there to teach or train the trainers. Actually, sir says TOT, training of the trainers. And what so many times we say, in smiling, the training of the trustees. Actually, you don't need training of the staff, you need training of the trustees. To register and network all healthcare executives and healthcare bodies, institutions of India. Number one, see, database is important. You people may be knowing very well. Because statistics makes a difference. Hell and heaven of a difference. What speaks? See, everything, everybody says, believe in me, I'm a perfect man. Or whatever I'm doing or I'm guiding or counseling, it's the right thing. I say, everyone, believe only in God. Otherwise, everyone else must come with data and figures. कोई भी बंदा बोलता है कि ये किया है, वो किया, मत बोलो. Figures लेके आओ, काम लेके आओ. तो figures कहाँ से लाएंगे? From where you are going to take out the statistics? If you are not able to see the IMR or MMR, you will not be able to see कि कितना pregnancy का problems आता है, कितना infant mortality है, कितना maternal mortality है. We have to produce the results. Otherwise, the world will not believe us. And honestly, that not only on the ground but on the same side, even small hospitals have a tremendous potential to grow. If they can see the statistics, they can take some of the beautiful decisions for their own growth. Again, difference between profitability and the growth. Yesterday's presentation of Dr. Pradeep Jubanputra was excellent. He has beautifully 2-3 sentences he uttered. I don't know people have marked it or not, but it's really excellent. It's eye-opener statements. If you don't do, thumb machine वाला examples here दिया. How many of hospitals has a biometric machine? Okay, everyone. किन्होंने कितनी बार देखा वो सैलरी के अलावा बायोमेट्रिक्स को एनालिसिस? How many times you have done an analysis? You have seen how many persons comes in pay either the late or the right time. There are many things you can evaluate and analyze if you really manage the data. So data management is very important. Therefore, my first actually difficulty is obtaining the data. Unfortunately, nobody is entering the data. पेशेंट आया उसका नाम तो डालो. सर ने बोला ना 30-40% छुड़ा दो क्योंकि आईटी में प्रॉब्लम्स हो जाता है.
इनकम टैक्स आईटी यानी इंफॉर्मेशन टेक्नोलॉजी इनकम टैक्स.
काफी सारे डॉक्टर्स told us, and I insist upon that never ever remove any patients from your records. It is in your interest. Why? If any single patient is having some medical legal issues or some issues, problems in future, and they say, this is my records and I have taken this thing, and if it is not available in that hospital's record, it is going to create havoc for that hospital and doctor. What? There are many ways to save the taxes. Hire consultants. Rushi will be happy. There are financial consultants. Take the help of finance experts. Pay them. If you are going to pay them 5,000 rupees, they will save you 50,000 rupees. But that 5,000 rupees seems big. Arey yaar, 5,000 rupees, why you have to? So we are actually conservative in spending money on some of the things which is really essential and which can save money. So that is the thing. So I wanted to create that database, and I am going to actually, that is why I am going to give them the free source, and probably after receiving free software also, I know they are not going to enter the database. So I am going to provide manpower also. If they convince, yes, I wanted to take that help, I wanted to do the thing, I am going to send my men to enter the data. Patients का सुबह से शाम तक कितना patients आए डालो उसमें, कौन सा आया, कितना statistic लेगा, so that figures and some important data is available at a hand. So obtaining is important. So how are we going to function? To establish primary quality care standards to be maintained by small nursing homes, mid-sized hospitals as well as the large hospitals with the bed capacity of more than 150, which is less probably. To establish standards to ensure patient and hospital staff safety, to prepare member healthcare organizations all set for accreditation like ISNBH, etc. To provide training to staff of members organization as per the need, SS. To enlighten the legal compliance is necessary for all healthcare experts. Setups, and way to fulfill the same, to publish biannual journal of Indian healthcare. This is our actually e-newsletter. This is going to be e-newsletter. Right now we don't want to spend, or we just wanted to cut down the cost, and now in the time of an internet we can have e-newsletter, and that can help us. And we will be doing it a Twitter phenomena, not too much. Sir is writing too much and I am cutting it down to the main, because people usually doesn't follow. People usually doesn't follow. You have a very good stuff in it, and if people doesn't read it, I said, sir, give only 5 lines, 10 lines. Let them follow. Let them work. And you check it, you adjust it, and you audit it, and then give another 5 lines.
Problem is, everything is given on the internet. Downloading, cutting, copying and pasting the things is very common. But the thing is, pasting in the minds is very uncommon.
Pasting in the mind is very uncommon. So that the another idea is keeping the directory not of the patients only, doctors, hospitals, but the patients also. I am going to create such a large database. So tools and equipments, usually how we can do it. So human resource intense industry, healthcare industry, I always take it's an HR intense industry. There are no some कोई material नहीं लिया और बेचा, कुछ production किया और बेचा. It's not like that. It's a service, and definitely service is provided by the human resources. Human skill set operates upon mind and logic. Now here actually problem comes in. Mind and logic doesn't apply. And that is where why training, you have to inculcate them, the values, ethics, information, everything. And you have to, literally, I say, so many times when I identify a person, I say, "Goda ni jo main bandi dewa." You identify the limits. I appreciate Mr. P.C. Patel's lecture. He said that તમે change કરવાનું જો નહીં થાય માણસો માટે. જેવા change કરવાનું તો change a behavior impossible task. काफी सारे psychologists लगे पड़े हैं, लेकिन changing a behavior is not a task. हाँ, change होता है in ashram industry. If you can go, there is people are dedicated and committed without any mind and logic. So human resource training and implementation with service, IT, knowledge dissemination, knowledge application, assessment and audit for continuous improvement in quality. This is last is very important. Quality plan करना easy है. To plan a quality is very easy. Initially नव setup हो तैयार करिए, everyone is enthused to create that setup. अरे बहुत बढ़िया करना है. Father, we have to create the best of the best hospitals. We have created it. Then, when the time comes, it gets stagnated. Mindset becomes, it's a continuous process, and people usually, પછી છે ને ઢાંચામાં ઢળી જાય. It just gets used to it. ऐसा तो ऐसा ही चलता है. Over a period of time, that deteriorates. To maintain quality control is very important. For the control, you need to have audits. You need to have checkpoints. You need to have continuous monitoring of that process. And the last phase, which I learned from Sir, what he said, quality is continuously improving. It has to be enhancement. Quality enhancement is the third step, and one has to go for
process. Continuous quality improvement. The thing is, every organization and human being has got three phases in his life: growth, maturity and decline. And in this growth and maturity stages, they have to follow the game plan, maximizing the profits and minimizing the loss. This is what which has to be observed all over the healthcare industry. In fact, in our country, we need 2,75,000 hospital beds every year at present, and 150,000 super specialty beds we require. So, in a way, healthcare industry is booming today, and lot of opportunities are being created. It is said that in coming years, more than 20 lakh employment opportunities will be created. So, the thing is, opportunities are tremendous, but to integrate them at a unique level, at a platform which is palatable and common to all, it should be a learning platform for everybody.